Okay, thank you for joining and welcome to today's webinar. This is an introduction to the HIPAA Security Rule and is brought to you by Proactive IT. Today will be brief and we will be discussing HIPAA security compliance, which is very easy and very simple to understand. Even if you knew nothing at all about the HIPAA security rule before today, by the time the webinar is over, you'll be able to put a plan together that will give your organization or your clients a solid strategy to begin complying with the HIPAA security rule. Okay, we're going to break it down into logical steps and show you a roadmap. All right. First, just a couple of housekeeping items. If you're attending today's webinar live, I encourage you to ask questions. There's a Q&A link on your screen. Click it, type your first name, type your industry, type your question, click submit, and we'll do our best to answer yours in real time. If not, we will follow up with you after. Now, if you're listening to a recording, you'll find my contact information on the last slide. Please feel free to contact me with any questions anytime. Okay, so let's dive right in. Good afternoon. My name is Mark Serqua. I'm a VCIO for Proactive IT. I've been in the business a little over 10 years, navigating a range of technology channels, if you will, and I've brought the team with me today. We have Noel Sutherland. He's the Director of IT and a VCIO for Proactive IT. Noel has 17 years experience in the space. And saving the best for last, our company visionary, Keith Foda, CEO of Proactive IT. Keith's been in the business for over 25 years, and Keith sits on the CompTIA Advisory Committee. And if you didn't know, CompTIA is the voice of the world's IT industry. Well, that's enough about us. Let's talk about this HIPAA security rule and compliance. How was that accomplished? So, the Health Insurance Portability and Accountability Act of 1996, HIPAA, okay? This is United States legislation. It provides data privacy and security provisions for safeguarding medical information. Now, the Act has 5 sections, and Section 2 directs the Office of Civil Rights, the OCR, which is part of the Department of Health and Human Services, to establish standards for processing electronic healthcare transactions. It also requires healthcare organizations to implement secure electronic access to health data and remain in compliance with privacy regulations. Now, to understand HIPAA security, we need to be aware of 3 important HIPAA rules. 1, the privacy rule, 2, the security rule, and 3, the omnibus rule, okay? The privacy rule focuses on the rights of individuals to control the use of their personal information. The security rule, which is a critical path toward compliancy, and it's what we're discussing here today, defines the standards for safeguarding protected health information, specifically in electronic form, from unauthorized disclosures, destruction, or loss. Now, the omnibus rule, this expands the definition of a business associate and directly regulates these business associates and their subcontractors. And we're going to be looking at what a business associate is shortly. One of the other relevant items to mention here is the HITECH Act, which basically increased the categories of violations and increased the levels of culpability, and it made HIPAA infractions more stiff. And this is why we're seeing these huge fines happen every day. Now, privacy depends in part on security measures to ensure and confidentiality. So the two rules are interwoven with one another. Again, today we're focusing only on the security rule. Electronic protected health information, ePHI, is at the heart of the security rule. We're talking about ensuring the confidentiality and integrity of electronic medical records, electronic claims, computer databases with treatment history, digital x-rays, email, paper printouts of electronic information. Now, there are two groups which are affected by the HIPAA security rule. Specifically, one, covered entities, two, business associates, okay? Covered entities, these are healthcare providers, these are health plans, these are healthcare clearinghouses. So we're talking about physicians, dentists, all the way over to pharmacies, health insurance companies and HMOs, and entities who process non-standard health information within the scope of a covered entity, okay? Business associates, these are all third-party vendors and business partners that receive, create, maintain, or transmit protected health information on behalf of a covered entity. So we're talking about your accountants, your lawyers, your medical answering services, consultants, medical software companies, medical storage companies, medical transcription companies, asset recyclers, medical staffing companies, medical transport companies, medical couriers. Okay, these are all business associates that are required to comply. Also, let's look at some examples of HIPAA security rule violations that brought on some very hefty fines, okay, up to $50,000 per record, okay. Look at the pie chart, you'll see a breakdown of the source of data breaches since 2015. We've seen an emergency clinic lose all its patients' health records after the network crashed from a virus. They didn't have backups. We saw a temporary employee of a rehabilitation clinic stole patients' personal information and opened up fraudulent credit card accounts. There was a hacker who found a web page used by a consulting firm. This was found on the dark web, and it linked to a database of 5,500 electronic protected health records. Now, at up to $50,000 per record, you can see why those fines are skyrocketing. Now, I know everyone here loves surveys, and a survey was recently conducted. There's an incredible opportunity for improvement here, okay? First of all, 95% of healthcare organizations have internet connectivity. No surprise there. What is surprising is that, or what's alarming is that 25% of that group have no firewall, okay? Not even a basic security device. And I'm watching this happen with my own eyes every single day. Another big number, only 24% of covered entities and business associates actually conduct and execute security awareness programs. So in this day and age, if you or your clients fall into one of these categories, you're highly likely to experience a data breach. And with the Omnibus rule and the HITECH Act in play, you stand a high chance of getting a not so pleasant visit from the OCR, the Office of Civil Rights, managed by the Department of Health and Human Services, and getting fined for a HIPAA violation. Now, let's get to the good stuff, okay? There's light at the end of this tunnel. We're going to go over this roadmap to get you and or your clients and or your organization compliant with the HIPAA security rule. Now, I want to make one thing very clear. There's no definitive prescription that can be applied to all companies which would make them HIPAA compliant, okay? With each individual organization, there's going to be different levels of detail, different variations, which would make it impossible to develop a definitive guide. Now, a covered entity And a business associate listening to today's webinar can focus on these concepts presented to establish a foundation on how to get started. Okay, these 6 bullet points you see here cover the entire security rule. So we're going to summarize each one today and dig into the specifics of each section during the webinars over the next few weeks. So here it is. Feel free to take notes, but I will be sending out an email to everyone with the slide deck and more detail. Okay, so the very first thing one needs to do when developing a HIPAA security strategy is to perform a HIPAA IT assessment. Okay, you see it there. It's the first thing. Very important, right? Let's look through the high level 6 steps, and you can see those drill down into subsections. Okay, the second section is addressing security safeguards. The third section, drafting policies and procedures. The fourth section, risk analysis. The fifth section, implementation. Okay, and the sixth section, most important, okay, testing the system, continual improvement. Okay, so let's look at the first step. Okay, performing a HIPAA IT assessment, and there's a clear distinction between an assessment and an audit. Okay, a HIPAA security assessment is performed proactively, and these are preemptive projects. In contrast, a HIPAA security audit is performed reactively and typically triggered by a data breach and are more increasingly becoming ones that are performed by the OCR. So we can break this network assessment down into 3 parts. And it starts with having a business discussion with the company stakeholders about growth plans, cloud initiatives, infrastructure requirements to support those initiatives. Okay, and listen, before we go any further, this HIPAA security rule and ePHI, this is a leadership issue, okay, that should be driven by the CEO with all other C-level executives as champions, okay? Anyone who's under the impression that a HIPAA security rule compliant engagement can be achieved in the vacuum of an IT department should do more research, okay? This isn't about IT. We're looking at the big picture here. Okay, the second step of a network assessment is walk through the work environment. Okay, take photos of all the physical systems. Note any obvious issues like a server that's in the break room, for example. Okay, third part, have a network diagnostic. Okay, this can be accomplished through secure and encrypted software tools that will generate a digital IT infrastructure report of all the network activity, servers, desktops, switches, firewall software, any and everything on the network that gets scanned and vulnerabilities are detected. And you're provided with a deliverable report. Okay? Number 2, addressing security safeguards. The HIPAA security rule, it includes addressing these security safeguards. It's broken down into administrative, physical, and technical. Now, each of these safeguards will be discussed in more detail throughout the 8-part webinar series, so please stay tuned. Now, if you do require any of this information immediately, contact me. I can help you. My team and I can help you. Again, my contact information is on the last slide of the slide deck, okay? The third step in the process, draft policies and procedures for each component. Now, like I said earlier, there's no definition for policy or procedure, okay? Policies and procedures will look different. If we studied 10 different companies, you'll see 10 different policies and procedures. What's important is that the business policies establish measurable objectives and expectations for the employees, that they assign responsibility for decision making, and that they define enforcement and consequences for violations. On the other side, procedures, these describe how the organization carries out that approach and sets forth explicit step-by-step instructions that implement the organization's policies. Okay, I hope that made sense to everyone. Going on to risk analysis and risk management. Okay, the fourth step of our plan, develop a risk analysis strategy. Okay, determine your risk management, and again, there's no prescription on a specific methodology. Okay, it can be difficult due to all the different levels of detail and variations across organizations. But the bottom line here is to create a process of identifying potential risks and make decisions on how to address security risks associated with each standard. Okay, let's move on. Let's say you've completed a HIPAA IT assessment, you've fortified all your administrative safeguards, you've created policies and procedures, you've developed a risk analysis strategy, and by golly, you're demonstrating risk management. Now, you have to implement the system and execute, okay? Many of these standards have implementation specifications. Now, I know you're going to ask me, Mark, what is an implementation specification? Here you go. This is a more detailed description of a method or approach an organization can use to meet a particular standard, okay? But remember, each organization is going to use different approaches. So these implementation specifications are either required or addressable. Now, required implementation specification standards, these must be complied with. Very simple to understand. Addressable is a little more gray. Okay, this says that the organization must perform an assessment to determine whether the specification is reasonable or appropriate. Okay, once that assessment is done, then the covered entity will decide if it will implement the solution or if it will implement an alternative or an equivalent solution, or if it will not implement a solution or an alternative solution. Okay, so if equivalent measures are not reasonable and appropriate in the work environment, the covered entity or that business associate may choose not to implement the solution. Here's an example. All covered entities, including small providers, must determine if encryption is reasonable and appropriate for the environment. Now, it may or may not be for you, but make sure you have evidence and documentation to support that decision. Factors that determine what is reasonable and appropriate do include cost, size, infrastructure, resources. Cost is one factor that people have to consider, but it doesn't free anyone from meeting any of the standards. Okay, in certain cases, appropriate measures just must be implemented regardless of the cost. Now, let's say we've completed the first 5 steps. We're under compliance with the HIPAA Security Rule. Now we need to test the system to see if it works. Think of testing as a fire drill done on a quarterly basis. Through your testing process, your plan and your strategy will improve. Your tactics will become more efficient. You'll lower costs, okay? And you'll save your organization from a potentially devastating fine and maybe even embarrassing press, okay? So as you can see, HIPAA security compliance, it's a board level conversation, and all companies should be having this conversation. led by the CEO, championed by the C-suite executives. Now that you have a game plan to comply with the security rule, it's time to execute. Follow these 6 easy steps and avoid becoming a victim. And my team and I are here to assist anyone who needs help developing their game plan. If you need any more information on putting all this together, please email me here, mcirqua@pro-activeit.com on your screen there, or you can call me at the office. You see my phone number there. With that, we're going to officially wrap up this webinar. Have a nice day, everyone.